the last presentations from Ben Barry. And Ben's going to talk to us about choosing wisely when patients deteriorate. Thanks, Ben.
Thanks. Just look at how this works. So is that which one's the laser? Which bit's the pointer?
So that way, and that's your laser.
The red one. Good. Now I know where the pointer is. Good. First of all, I'd just like to say thank you to the Council of Medical Colleges of New Zealand for asking me to present this work of their work with the Choosing Wisely campaign, and also to Sue Einerson from the Council who's prepared the slides for me. I guess this is a bit of a public service announcement, a bit of an infomercial in some ways, rather than a detailed presentation of hard work unlike the other presentations this afternoon. Just want to get an idea of audience. Who here actually is aware of the Choosing Wisely campaign and what they do? Good. So that's a minority. Good. So not talking to people who know everything already. So in terms of the background, what I'm going to talk about. So the Choosing Wisely campaign, I'll tell you a bit about that, why it started, how New Zealand is involved currently, about how Choosing Wisely is aimed at health professionals, but also at patients to be partners in the healthcare process, and tell you about some of the recommendations made by the Choosing Wisely campaign. So the problem that was seen coming out of the USA, the problem that was seen was the unnecessary burden of healthcare, and some of that's about the costs involved. As many of you are probably aware, USA is very expensive in terms of healthcare. Healthcare is sort of 17-18% of GDP, which is about twice the expenditure in New Zealand. And what was seen was that there's this rapidly increasing wedge of waste, which includes overtreatment, but also the unnecessary administrative complexity, pricing failures. And this is seen in the UK as well, where everyone thinks they're getting the best deal from the hip manufacturers or the whatever manufacturers. There's pricing failures, there's regional variations, there's so many ever-increasing costs in healthcare that could be contained. But this overtreatment issue is what Choosing Wisely tries to address. And it's about trying to reduce the burden of unnecessary care on patients, particularly where treatment, investigation, the risk of harm exceeds any benefits, but also as a secondary thing where the financial cost doesn't provide the expected benefit. And there's certainly a problem in New Zealand, certainly by surveying healthcare professionals, by asking doctors. More than half of doctors in New Zealand do believe that there's a problem in terms of unnecessary tests and treatments and procedures being carried out on patients. Of course, it's always that other doctor who does it, not me. And consumers notice it as well, that when questioned by Consumer New Zealand, 1 in 5 consumers feel that their doctor has recommended tests or treatments that, on reflection, probably weren't actually necessary. So this is a global campaign, coming out of the USA, but involving now over 20 countries around the world, including Australia, New Zealand, England, Wales, but not Scotland. Not sure why. And there's growing evidence of problem, sorry, jump on there, specific examples of where there's a problem, such as antibiotic overuse, knee replacement, other knee surgeries, cardiology investigations, and deployment of stents. And as I say, there's this regional variation, between countries, within countries, regional variation, one city to another. And we all know there's differences in terms of practice between individuals working in the same city, in the same hospital. So I guess of interest to us, there's the question about the issue of possibly over-treatment at the end of life. And the end of life is often something that's quite protracted and drawn out due to modern medicine these days. And we know that healthcare costs, a lot of spending goes on for people in their final year of life, and a lot of that's in the last couple of weeks of life, and sometimes in the last few days of life. And I guess trying to disentangle when that's appropriate and when that's inappropriate, and when we can actually say enough's enough. So in New Zealand, the Council of Medical Colleges oversees the Choosing Wisely campaign, and it's an umbrella organisation that has 15 different medical colleges involved. And those medical colleges, because it includes things like RACP and colleges of surgeons, that's actually more like 36 different specialties. And those colleges, obviously, as well as overseeing postgraduate training, also have a role for supporting professionalism. So generally what's happened is that different organisations have produced a series of recommendations, usually 5 recommendations of things that can be done or not done to reduce the burden of excessive healthcare generally. And principles involved are, I think importantly, this is something that should be coming from health professionals. So this is not a ministry or even like HQSC directed process. This is something that's coming from the medical colleges, from medical societies, so from clinicians. Also, it should be patient-centred, moving the focus of what we do back to the patients rather than what we want to do for running our business. The recommendations obviously have to be evidence-based, and transparency of how those recommendations are put together. And also, although not particularly well, I don't think, in some specialties, that the aim is that this should be multi-professional, so not just medical, but nursing, physiotherapy, midwifery, pharmacy, etc., also involved. So, I say the idea is to produce these recommendations and based on evidence, and to assist healthcare professionals providing better care and reducing burden of unnecessary care. So just to run through a few of these recommendations, one of the recommendations of ASIM is that the emergency department can be the time for recognising end of life, and it's never too late to recognise when you need to have the discussion about end of life, and informing and involving patient, family, whānau in decision, and also perhaps involving palliative care physicians at that time. Similarly, there's recommendations from the New Zealand Society of Palliative Medicine. Again, don't delay on referral. It's not just about the dying process. Initiate those conversations early. And a couple of examples of things not to be doing. Don't go giving oxygen to people who say they're dyspneic. It's not going to help. Maybe talking, holding a hand, and other means of relieving distress are going to be more useful. And looking for medication interactions are going to harm the patient. I guess I know probably a bit more about the recommendations of sorry, this is a bit garbled, the College of Intensive Care Medicine, and the Australian and New Zealand Society the Australian New Zealand Intensive Care Society. So it's joint recommendations of the college and the Intensive Care Society. And the recommendations that we have are similar to recommendations from other critical care organisations, such as in the US it's the American College of Chest Physicians and the SCCM, which is a very good multidisciplinary organisation. So number one in our recommendations is that we recognise those patients who have a limited life expectancy. For example, the obvious things such as advanced metastatic disease. And that we have goals of care discussions at the earliest opportunity, and that may be prior to, at ICU admission, or during ICU admission. Just for information, the other recommendations for intensive care are removing lines and devices as soon as you possibly can, having robust evidence-based transfusion thresholds, de-escalating antibiotics. Not everyone suffers from tazocin deficiency, and minimising sedation and sedation holds wherever possible. ANSCO also has some recommendations. Darryl alluded to the fact that these days most good anaesthetists can anaesthetise most patients and probably wake them up at the end. Patients never mind, or say they never mind, the idea of drifting off into oblivion and not waking up again. Sadly, we know that not only of patients over 70 having non-cardiac surgery that requires a in-hospital stay, an overnight stay or longer, patients over 70 having non-day stay surgery, 5% die within the next 30 days. And of patients who die, you're very unlikely to die during the anaesthetic or on the day of surgery. You're actually 1,000 times more likely to die in the next 30 days than you are on the day of surgery. So it's not going to be a pleasant process. So avoiding unnecessary surgery, obviously a good idea. So also we've got recommendations from the Society of Clinical and Experimental Pharmacologists and Toxicologists. Obvious, avoid harm by unnecessary medication and interactions. So in terms of how this gets put into practice, I think is the challenge. And I think the questions up there that patients and family can ask healthcare professionals are really important. Do I really need this test? What are the risks? Are there simpler, safer options? And what happens if I don't do anything? That you don't always have to do something, that the options can include watching and waiting to see what happens. Shared decision making, very important, and that is a process that requires some thought and some learning from healthcare professionals. It also requires a change in attitude from patients and families of getting involved. I think in asking questions. We heard a lot about maybe some of the reason for Māori being disadvantaged in healthcare is not wanting to ask questions, but we've all been in that situation where you're a patient or a parent of a patient, and it can be very, very difficult to challenge healthcare professionals and what they're doing and ask questions. And maybe we need to be a bit more inviting of people to ask those questions so that we can have a more level discussion about the goals of care and how we're going to achieve that. As has been said before, I think including Alex, the shared decision making takes some time and some thought, but it doesn't necessarily require a load of time, and certainly can save a lot of time. So well worth doing. So I think the big challenge is how we actually achieve this, and getting engagement not only from healthcare professionals but also from consumers. And I guess think about other situations where we try and involve the public more. I think organ donation is something that's been highly successful by the message going out there repeatedly over decades. Currently thinking about advanced care planning, and how we achieve better decision-making about goals of care. But also, yeah, these decisions about what treatments you want and don't want. So we've got support from various people. Sorry, that hadn't displayed very well. From various people, organisations around the country. And hopefully this is something that will improve healthcare and reduce the burden of unnecessary healthcare. If you'd like more information, do take a look at the Choosing Wisely website, or if you've got anything specific, contact Sue and the team at the Council of Medical Colleges. Thank you very much.